Hello, our Uganda team. This is Dr. Mike coming to you from Washington State. I just want to tell you that I had a visit with Ron yesterday, and we would say that he is over the moon, which would mean he's just excited and happy about his visit with you. He thinks you guys are doing great with the economic development work, and he's very happy with just what's happening also with the building as well. So very good news. Sounds like you had a good trip. I hope it was good for you guys as well. So today I'm going to present a little teaching video, and Oscar has kindly allowed me to use his name in a story, and I appreciate Oscar's sense of humor, and hopefully you'll see a little humor in this story as well. I'm using it to illustrate an important point in how you use medications and how you take a history. So let's see, thank you to the people who were at the hospital when we did the telephone call about the x-ray unit. I've got some good ideas, and I'll email those to Frank and Oscar about what our next steps should be. I think there's definitely a possibility that we might be able to make things work. So we'll keep working at it and see what we could do. So anyhow, good to see you again. I hope you enjoy this video. Once upon a time, my friend Oscar decided he wanted to go on a lion hunt. Oscar got out his gun and he lined up his rifle to shoot a lion. What he didn't notice was that behind the lion, a little bit to the left, was a baboon. So Oscar ended up shooting the poor baboon instead of the lion. This illustrates an important point whenever you're hunting, and it also applies to medicine. You must look at what's nearby, because you may hit that as well with either a pill or a bullet. We call this the field of fire. This hunter is shooting an elk. What's wrong with this picture? Can you see what's wrong? One hunter is a little bit behind the other hunter. If she shoots, she might hit her friend. The hunter must look forward and see where he is shooting and what might be out there. Now let's apply this principle to medicine. This patient has come in with some back pain. You can see he is hurting. What other questions should the clinical officer ask? If you're not careful, you might miss that he is also having difficulty with abdominal pain, and this is important. Asking the patient about his previous problems and also looking in the medical record to see what other medications he's taken and been prescribed and what other conditions he has recorded in the record or that he can tell you about is important. Let me explain why it's important to take a good history of previous illnesses and medications tried. This fellow has come in with back pain, but let's direct our attention to his stomach pain, which he hasn't mentioned to you. Food goes into our stomach, and there is dissolved by acid. We call this dissolving with acid a peptic process. Peptic comes from the Greek word for to cook. Acid is what breaks down our food and allows us to absorb it into our bodies. This next section shows a cross-section of the lining of the stomach. I want you to notice the thick blue covering of the stomach tissue, which is mucin. Mucin is made by our stomach lining to protect itself from its own acid. Some medications turn off mucin production by the stomach and allow an ulcer to develop. Look in the right-hand corner of this picture. You will see that NSAIDs are the medicines. Aspirin and ibuprofen turn off the mucin production and allow an ulcer to develop. So we need to be careful when we use these medications because we can actually cause a problem by using these medications. They are medications we use for back pain and joint pain, but they can also cause ulcers. These stomach pictures show evidence of ulcers. You can see red spots and white spots together, which are characteristic of an ulcer. the area of the stomach gets inflamed, and then the white area is the ulcer itself. So these ulcers are easy to see and are oftentimes caused by anti-inflammatory medications. So you can see how important it is to take a good history and find out what medication the patient is currently taking, because that can have a significant effect. Just like shooting at one animal and accidentally hitting another, you don't want to prescribe one medication for a problem and cause another problem. So always ask a patient what medications he's been taking. And be sure to ask if a patient is having stomach troubles before you prescribe an NSAID. This is a picture of a mountain lion which is found near my home. There are lions everywhere. Remember that the Bible says our adversary, the devil, is like a roaring lion. He's looking for who he can eat, and it's usually the weak and the young who he will go after. So be sure to keep yourself strong by being in the Word and being around other Christians so that you're not easy prey. So I hope you enjoyed the story of Oscar and the lion hunt, and you think about taking a good medical history, finding out what the medication is that the patient's already tried or taken, and think about what other conditions they might have which might be made worse if you prescribe an NSAID. Have a good week. We love you. Bye-bye.